subject of eating disorders has been a great importance to several of my constituents. They've come to my office, both in D.C. but also locally. In October, I met with a group of advocates and heard their personal stories about how they or their loved ones were affected by these debilitating mental illnesses. What are some of the biggest challenges to identifying the early signs of an eating disorder?
So, eating-related pathology has an interesting characteristic, which is that people tend to not want to be discovered, right? So people in other areas of medicine want to seek the help and want others to know because that's the path to accessing help. In eating disorders, that is not the case. There's a lot of secretiveness in the clinical presentations of an eating disorder. So imagine, a 14-year-old who, learns about some of this in the internet or may have some friends that have been affected. They talk about it, and she sort of begins to change her behavior into restriction and dieting and exercise. Well, she doesn't want anybody to know. That's one of the biggest challenges discover. Hence the importance of educating those in the front lines, those individuals that really day-to-day are interacting with children.
So what should they,
parents
and I know you brought it up, I hate to interrupt, but what should we look for? A loved one look for, a parent look for?
So we should look for
How can we
change.
detect it?
We should look for signs that are telling us that something is really changing in the way this individual views themselves and is trying to project themselves and fit into the world around them. So when a young person starts to make self-deprecating statements about their size, their weight, their appearance, their desirability, when a young person starts to, make excuses to not eat, when a young person is losing weight and stops participating in the normal activities that they have had interest in and love, especially social aspects of them, then I think families need to sort of pick that up and become concerned and seek appropriate assessment.
Thank you. What are the most effective early intervention treatments?
So the diagnosis, formalizing the diagnosis becomes very important. So after a screening test that raises a level of suspicion or parental familial concern, a thorough assessment becomes really important. And that assessment includes looking for medical complications of the eating disorder behaviors and psychiatric complications of the eating disorder behaviors. Once a diagnosis is made, then you can sort of assess the level of severity. Where is the illness at, as you know, in the spectrum of severity of the illness, because that may determine where we start the treatment process. And so the different levels of care, including medical stabilization, psychiatric stabilization, outpatient services that are age-appropriate, disease-appropriate, intensive outpatient programs, partial hospitalization, residential treatment, and inpatient eating disorder specialized efforts are all in the armamentarium. And so that assessment helps guide the family in making the decision as to where is the most appropriate place to start.
How many millions of people are affected by this disorder?
About 30 million people, so about 20 million women and 10 million men at some point in their lives will be affected by an eating
Not just
disorder
teenagers, huh?
in the United States.
All ages.
All ages.
Okay, thank you. Thank you very much, Doctor. Doctor,